Hi there, team. Let's get started with the tibia and fibula today. Okay, so the tibia and the fibula. So as you might remember from one of my first lectures here, so the tibia and the fibula are actually making up the leg. Remember, the leg is the lower portion of the lower extremity. Because up here where the femur is, that's the thigh. And then down here in the pink box is the leg. And the leg, as you might remember also, the anterior surface of it is referred to as the crura, and the calf area or the posterior region is referred to as the sura. Okay? And so some really important things are, again, our directional terms. So remember, in the limbs, we always use proximal and distal, right? So proximal is closer to the mass of the body and distal is further away from the mass of the body. Next, we have the lateral and medial terms. So the tibia here, the tibia is the larger bone. The tibia is always going to be medial. And so it's the main weight-bearing bone of the leg. And then that leaves the fibula to be lateral, so that it's always lateral to the tibia. And it's of lesser significance in the leg. All right, for the tibia, let's start out here, and we have the medial and lateral condyles. So condyle comes from the Greek word for knuckle, so you can kind of just think of these as big knuckles, and the condyles are actually coming together to then be in close association with an articular surface, right? So you can imagine coming up here, if you were to imagine what comes next, if we moved proximally, it would be the femur. So the femur articulates here, it articulates just proximal to the condyles. So we have the lateral condyle and the medial condyle. And you'll notice also that the medial condyle is slightly larger than the lateral condyle because the medial side bears more of the weight. Now we have the articulating and non-articulating surfaces of the tibia. So these are just general terms. So articulating means that it's going to be contributing to movement at a joint. So like we just talked about here, you can imagine your femur is lying just proximal to this tibia. So this would be an articular surface. So the proximal articular surface of the tibia, and then we also have a distal articular surface of the tibia. And so this is actually going to be what's kind of interacting to make our ankle with our tarsal bones. And then we also have a small point of articulation here where the fibula is going to be interacting with the tibia. You'll see it better on a subsequent image here. And everything else in that photo would be non-articulating because there's nothing articulating here. There are no joints along here. It's really only at the proximal and distal ends, and then just a little bit here for the fibula also. So now we have the intercondylar eminence. So remember, we just learned the terms condyle. So your two condyles are here. So between the two condyles, and that would be your intercondylar eminence. Eminence is a small protrusion from the bone. The fibular articular facet. So this is the articulation point that I was just talking about on the tibia. That's where part of the fibula is going to be interacting with the tibia. On the proximal aspect of the bone, this is just the posterior view, but this is our normal anterior view. And you can also see it here, you can imagine it would just be a little bit posterior to this surface of the bone. And then we have the popliteal or soleal line. So as you might remember, the popliteal region is going to be the posterior surface of the knee. So posterior surface of the knee is popliteal. So then you can imagine that this nice line running down here on the posterior surface of the tibia would be referred to as the popliteal line. It's also called the soleal line. We'll learn about a muscle called soleus that's associated with this structure, but we won't go into that now. So whichever way helps you remember what this structure is, then let that work for you. Next, we have the tibial tuberosity. So that's going to be this projection here from the bone. It's quite big. There are major structures that attach to it once we start to study the muscles. So tibial tuberosity, really nice and prominent on the anterior surface of the tibia. Then we have the anterior crest. So you can almost imagine this anterior, or the tibial tuberosity, kind of almost funneling down to this very sharp crest, almost like a sharp ridge line running down here on the anterior surface of the bone. The interosseous crest, or border, is going to be lining here. Again, it comes to kind of a sharp ridge on the lateral surface of the tibia. And that's where that interosseous membrane is going to be located. So the interosseous membrane is located and associating the tibia and the fibula. And the interosseous membrane itself is a fibrous joint called a syndesmosis with very little movement associated with it. So that's going to be running right through there, just as my mouse kind of goes, just running the membrane right through there. The fibular notch is going to be on the distal end, and it's kind of just where it looks like almost a little bite of the tibia has been taken out on the distal end here, where the tibia is then going to rest pretty nicely. And I have a really nice radiograph to demonstrate that also. And then finally, we have the medial malleolus. So malleolus actually stems from the term of like hammerhead or like a mallet head. So you can kind of picture it there if that helps you to remember it. But you can actually feel your medial malleolus if you just put your finger and your thumb on the pointy parts of your ankle, so kind of on the medial and lateral sides. And the medial side, whatever finger is touching that one, is actually touching the medial malleolus, or, you know, that most medial part of the tibia. And then we have the fibula. It's relatively straightforward here, so that's nice. So starting out with the fibular head is going to be located proximally, and it's really just a long, skinny bone. So fibular head is proximal. That's just this area here, fibular head. Next, we have the articular facet. So you can see this nice little scooped out region, and the white is kind of supposed to signify the articular cartilage associated there. So that's the articular facet of the fibula. And the articular facet of the fibula is going to be associated with the fibular articular facet of the tibia. And then finally here we have the neck of the fibula. So when there's a head, there's normally a neck also associated with it, just distally. And then on the fibula, because we know that that interosseous ligament is going to be, or interosseous membrane is going to be lying here, it also has an interosseous crest or border. So on the fibula, the interosseous crest is going to be located on the medial side because it has to be reaching out towards the tibia, and the fibula is always lateral. So that's going to be just running straight down through there, nice and sharp on the edge. And then we have the lateral malleolus. So remember, we had the medial malleolus over here on the tibia, lateral fibula over here, and this surface is going to be the lateral malleolus. So again, touch your ankle. The finger on the outside or the lateral side is going to be touching the lateral malleolus, which is made up by the fibula. And then finally, we have the malleolar fossa, which is just this shallow depression that's going to be here on the medial side of the fibula, closer to the tibia. Okay, and then I just want to show you this radiograph. I think it's nice for some real life perspective. So this is a radiograph where the leg is facing directly towards us. Okay, so this is called an AP view or an anterior posterior view. So we're looking at the anterior portion facing us. So as you can see really nicely here, we have the tibia, and then we have the fibula, and we can see here our medial condyle, our lateral condyle, and then remember the intercondylar eminence right up here, poking up in between the two condyles. You can appreciate almost that there's a little bit of a changed opacity here for the tibial tuberosity, and then just picture it coming down and making a sharp crest, forming the anterior crest of the tibia. Our little guy friend down here, the medial malleolus, followed by, just over here by my cursor, the lateral malleolus. And you can actually appreciate here that fibular notch that I was talking about in the tibia, where you can see that the fibula just lays in there really nicely. So the fibular notch right there in the tibia. And then you can imagine your interosseous membrane or ligament would be kind of spanning and webbing in between here, and then the sharp interosseous crest or border running alongside there. So we have the fibular head, the fibular neck, the articulation point up here between the two bones, and this is just a lateral view kind of showing you the same things, but you can actually appreciate the tibial tuberosity a little bit better over here. Okay? Thanks for watching. I hope this was helpful. Please contact me via email if you got it from Professor Craig, or please contact her if you're interested in setting up any virtual office hours to review any Unit 1 material. Any of the TAs are happy to be here and help you guys with anything that you need. We're here because we love teaching anatomy, and we're here for you. So thank you very much.